Hello everybody, in this video I'm discussing ECG interpretation, so let's get started. ECG represents electrical activity within the heart corresponding to different point in the cardiac cycle. A normal 12-lead ECG is taken by using 4 limb electrodes and 6 chest electrodes. Each lead gives a slightly different view of the ear. First is calculating the heart rate. A normal adult heartbeats at 60 to 100 beats per minute, with bradycardia meaning slower than this and tachycardia being faster. Head with a positive deflection when the activity is towards that electrode and negative when it is away from it. Okay, here lead 1 AVL, V5 and V6 at the lateral part of the heart. Okay, 2 V2 and V3 and AVF, the inferior part of the heart. V1 to V4, a septal and anterior part of the heart. The cardiac axis refers to average direction of electrical depolarization through the ventricles in healthy individuals. This average direction is somewhere between -60 and positive 90 degrees. In the coronal plane, common causes of left axis deviation include inferior myocardial infarction or Wife-Parkinson-White syndrome, and right axis deviation causes include inferior lateral myocardial infarction.